Dr. Mkoy. Dr. Mkoy,
Yes, yeah,
how are you?
I'm fine.
Are you locked in in documents or what?
Sorry,
Budgets.
I didn't get you. You're muted. You're muted, Prof. You're muted. Prof. Mbogo, you're muted.
Oh, yes. Just check whether you are. I was checking whether you are connected to two gadgets because I was seeing you twice. So,
And probably the other one can be removed because I was trying to get in the first time and I failed. So it's just one gadget at the moment.
yeah, there's some echo behind you.
Oh, I don't know. I should change my position. Is it is it better?
Yes, it's better now.
Okay, good morning, everybody. We are about to go live. We just in another 1 minute or so. Okay, good morning, everybody. I would like to welcome you to this session, the 11th KASH conference. And this is the first virtual conference that we are hosting here at KEMRI. I'm Dr. Veronica Manduku, who is the moderator for this first session. With me is Dr. Damaris Matoke. Maybe she'll just say hi. Hi. Okay, thank you very much. So the chair of this session is Dr. Amkoe Evans. Dr. Amkoe is the acting director for research and development at KEMRI. I would like to invite him to just take over the session. But before I do that, I just want to remind everybody to be able to follow up these sessions, that we're just going to have all our mics muted, that whenever you're in session, if you are not speaking, ensure your mic is muted. Also, to improve internet connectivity, would like to have also the videos also closed or muted. Thank you very much. So we'll go ahead and invite Dr. Amkoe. Dr. Amkoe, please join us and be able to start off this meeting.
Thank you, Dr. Veronica. We are very excited to have this 11th KEMRI Annual Scientific Health Conference with 3 days of very...
Dr. Amkoe, we cannot hear you clearly.
Can you hear me now? Hello?
Hi.
Can you unmute me? Hello? Hello? Can you hear me now?
Yeah, we can hear you.
Yes, we can.
We cannot hear Dr. Amkoe.
Good morning, everyone.
I think we need to sort your volume.
Dr. Manduku, it looks everybody can hear me. It's probably on your side. So
yeah, we can hear you, Doctor. We can hear you.
Okay, I can go ahead. Welcome to the 11th KASH conference. And today we have got, we'll be starting 3 days of very interesting discussions. Before we start, I would like now to probably acknowledge our visitors, Dr. Mercy Mwangangi, who is our guest of honor, and Chief Administrative Secretary, Dr. Daniel M. Binder, the chair of the conference, Professor Sam Karaoke, the chair of the board of management, Professor Sam Karaoke, the CEO of KEMRI, and the chair of the KASH, Charles Mbogo. We also welcome all the scientists who have come here, the distinguished guests, and everybody else who have joined in online. Before we start, we'd like to have a blessing from our Almighty, as is tradition of Kenya Medical Research Institute. I now invite Mr. James Karaoke to give us a word of prayer. James Karaoke.
Thank you, Chair. Let us be in agreement in prayer. Heavenly Father, the maker of the heaven and the earth, it's a beautiful morning that we come before you, Lord, on the start of this great occasion. We do ask that, Father, you do bless us, and we invite you in our deliberations. In your great name we pray, and all God's children say, amen. Over to you, Chair.
Thank you, James. The next person I'm inviting now is to give the conference overview, is the chair of the KASH conference organizing committee, Professor Charles Mbogo, who has hosted a lot of successful meetings before. Professor Charles Mbogo, welcome.
Okay, thank you very much, Dr. Amkoe. I'm the chair, Charles Mbogo, and I wish to welcome you all to this conference. The Chief Secretary, Ministry of Health, Dr. Mercy Mwangangi, Chairman, KEMRI Board of Directors, the Acting Director General, KEMRI, Professor Sam Karaoke, KEMRI Board members present, key plenary speakers, KEMRI directorates, and distinguished scientists and participants, ladies and gentlemen. I'm pleased on behalf of the conference organizing committee to welcome you to our 11th KASH conference. You will of course note that the 11th KASH conference is unique in two fundamental ways. It is being held online, and secondly, away from the traditional month of February. Notwithstanding the exceptionality of our conference this year, the 11th KASH conference maintains its rich scientific program that includes 74 abstracts, and symposium titles covering current issues representing at least 300 authors. In keeping with our tradition, this year's theme, Strengthening Health Systems in Kenya through Research, Pandemic Preparedness, Technology and Innovations in the Post-COVID Era. Plenary and scientific sessions will focus on new scientific knowledge and offer many opportunities for structured discourse on the current major issue, the COVID-19 pandemic facing healthcare in Kenya and the African region. With a wide variety of presentations, from oral online presentations in 13 scientific sessions, 3 symposia, and 5 plenary discussions, there is certainly something for everyone. Ladies and gentlemen, we have lined distinguished research leaders who will both address participants during the 3 days conference. Today, we are honored to have Dr. Zulu Eliaya, the Executive Director and founder of the African Institute for Development Policy, AVIDEP, who will give the keynote address. Others include Professor Frederick Chite Asirwa, the CEO of International Cancer Institutes, and the consultant physician, chief medical oncologist and hematologist based in Eldoret. Professor Kariuki Njenga, the infectious disease Don, is with Washington State University and Global Health Program and Chief Research Officer at KEMRI. Professor Lukoye Atwoli, the Dean of the Aga Khan University Medical College, East Africa. Ms. Emma Olifua, Programs Director, Africa, the Global Action Fund for Fungal Infections, Gavi, and the co-founder of PAMCA. Professor Lukoye, Dr. Benjamin Sova, the immediate former Deputy Director at KEMRI Center for Geographic Medicine Research Coast, and the Principal Research Officer in charge of Health Policy and Systems Research, among others. In addition, we shall be launching the Cochrane Review Kenya chapter, a knowledge management platform, immediately after the opening ceremony. In the scientific sessions, a great mix of established and upcoming scientists are presented, with a good number of presentations coming from young scientists whose great efforts we highly commend. We encourage participants to take time beyond the online sessions to continue networking as they learn and mentor each other. We are confident that this conference will present us with an opportunity to share excellent experiences from our research, to discuss new ideas, and to make new friendships and collaborations. Karibuni sana. Thank you and welcome. Dr. Mkoya, over to you.
Okay. Dr. Mkoye, I think his mic shows like it has a problem. Okay, next, I'll just help him in this session. And just to welcome the Acting Director General and CEO KEMRI, Professor Sam Kariuki, who will be able to come in and will make his remarks, and also invite the board chair, Dr. Daniel Mbinda. So Professor Kariuki, welcome.
The Chief Administrative Secretary, Minister of Health, Dr. Mercy Mwangangi, the Chairman, KEMRI Board of Directors, Dr. Daniel Mbinda, KEMRI Board of Directors present, the Chairman, KASH Conference Organizing Committee, Professor Charles Mbogo, all key plenary speakers, KEMRI senior management members and staff present, distinguished scientists, and those participating with us online. Good morning, ladies and gentlemen. I take this opportunity to welcome you all to the 11th KEMRI Annual Scientific and Health Conference, otherwise abbreviated as KASH Conference, that begins this morning. This conference runs from today, 8th of June, 2021, to Thursday, 10th of June, 2021. It is indeed a very, very exciting moment for KEMRI to host this conference online, especially because it's the first time in its decade history of planning for this conference. Chief guest, ladies and gentlemen, the KASH conference is a special event in the Institute's calendar, and we are honored to have very special guests joining this conference online, a testimony particularly of your determination and resilience despite the prevailing COVID-19 pandemic. As an institute, we are honored especially with the presence of our Chief Administrative Secretary, Dr. Mercy Mwangangi, as our chief guest. Madam CS, please feel free and feel welcome and accept our utmost appreciation for your gracing this occasion. I also acknowledge the presence of other senior officials from the Ministry of Health and also our partners and collaborators globally, vice chancellors of public and private universities that are present, and other dignitaries and invited guests. I would also like to take this opportunity to sincerely thank my colleagues, especially those at the KASH Organizing Committee, led by Professor Charles Mbogo, and his committee members, who have worked tirelessly to overcome all the odds and challenges that are posed by COVID-19 pandemic to make this conference a reality at this moment. So, ladies and gentlemen, the 11th KASH conference is a forum for the dissemination of research findings and networking, not just for the young scientists, but also for the more experienced scientists to share their research outputs. The official launching of the Cochrane Review Kenya chapter is especially a very welcome moment for us at KEMRI, this being a knowledge management platform that is a testimony to the prowess of networking. The Cochrane Review is a platform that is geared towards improvement of health, where decisions about health and healthcare are informed by high-quality, relevant, and up-to-date synthesized research that is evidence-based. Let me take this opportunity to welcome all of you to visit our website at www.kemri.org to be able to access this resource, and especially to be able to gain from the wealth of research materials that will be posted during this process. In addition, if the caliber of key speakers and scientific presentations is anything to go by, then our standing as a leading health research institution is formidable, and especially because our research culture is robust, responsive, and result-oriented, and that cannot be overstated. Distinguished participants, please allow me to highlight a few items that stand out in the 11th KASH conference program. This year's conference theme is Strengthening Health Systems in Kenya through Research, Pandemic Preparedness, Technology, and Innovation in the Post-COVID-19 era. which is not just timely for the country in Kenya, but also for the rest of the Africa and also globally, because we are a global institution. We are in times that have really been ravaged by the prevailing COVID-19 pandemic. KEMRI stands strong, taking cognizance of the presidential declaration on the 4 pillars of development, in particular, the universal health coverage, for which KEMRI has been a key player and an institutional mandate for which we are then carrying out various activities to be able to support Ministry of Health and indeed the Kenyan public to be able to access affordable health care. As such, UHC is one of KEMRI's flagship programs in providing not only solutions for diagnostics and management of diseases, but also to be able to provide quality, affordable healthcare, including disease surveillance. Distinguished ladies and gentlemen, it is refreshing to note that out of the 77 abstracts received, 74 were of good quality and were accepted for presentation with at least one keynote speaker during each of the plenary sessions. So we have 5 total of plenary talks for this conference, and this will be very enriching for those that will be able to listen in and absorb all the materials that will be presented during this period of the conference. There are various thematic areas that are presented. Obviously, these include COVID-19 pandemic response and diagnostics and surveillance. The conference is also hosting at least 3 symposia and 13 different scientific sessions. The KASH conference is therefore a forum for dissemination of research findings from different networks and different scientific backgrounds. And we look forward to a very robust discussion that will come up with resolutions, and I believe solutions that are not just timely, but responsive and results-oriented to our current realities in our health systems. Finally, ladies and gentlemen, allow me to take this opportunity to sincerely appreciate the KEMRI Board of Directors, led by our board chair, Dr. Daniel Binda. The board has not only supported this conference previously and even the current one, but as management, we have continued to benefit from their wisdom, guidance, and direction. I wish to also sincerely thank all the participants at this conference, and especially those who submitted papers for presentation. Without participants, we cannot have a successful conference. Again, most sincere appreciations to all our partners and collaborators who have also supported us during our previous conferences and presently are here today also supporting us. Finally, a big thank you to the government of Kenya through the Ministry of Health, who have given us moral and financial support to make this conference a great success. I trust and believe that we will have a good and most successful conference, and I thank all participants and those that are going to present to be able to have the utmost out of this conference. God bless you all. Have a most successful conference.
Dr. Mkoe?
Thank you, Dr. Veronica Manduku. We will, the CEO of KEMRI, Professor Kariuki, will invite the chair of the board, Professor Kariuki. Professor Kariuki, could you please unmute and invite the chair of the board? I think the same technical issue I was having, maybe he may also be having the same technical issues. So I don't know if with the permission of our CEO, I would invite Professor
the Chief Administrative Secretary, Minister of Health. the Chief Administrative Secretary, Minister of Health, Dr. Mercy Mwangangi, fellow KEMRI Board of Directors present, the Acting Director General KEMRI, Professor Sam Kariuki, Chairman KASH Conference, Organizing Committee, Professor Charles Bogo, key plenary speakers, KEMRI directors present, distinguished participants, ladies and gentlemen, good morning. Let me take this opportunity on behalf of KEMRI Board of Directors to welcome you to the 11th KEMRI Annual Scientific Conference, which is being held online for the first time in its history. From the onset, I wish to extend a very special welcome to our chief guests, the Chief Administrative Secretary, Minister of Health, Dr. Mercy Mwangangi, who is also attending the KASH conference for the first time in her capacity as the Chief Administrative Secretary, as well as all other senior government officials that have joined, including the KEMRI Board of Directors present. Thank you, Madam CS, for gracing this very important conference being held at a very special period in our country's history as we fight the COVID-19 pandemic. In this context, and on behalf of the KEMRI Board and Management, we wish to thank the Minister of Health through you for the unwavering support the Minister has given to this institute. Ladies and gentlemen, I wish to most sincerely welcome all the keynote speakers and also celebrate the efforts of all the 74 participants whose abstracts were accepted. Without this, we will not have a conference this morning. Let me take this opportunity to congratulate KEMRI for launching the Cochrane Review chapter today. We salute KEMRI for this bold step to partner with Cochrane in furtherance of research for improvement of human health in Kenya. It is my humble hope and trust that this will be the beginning of a long-term partnership which will hopefully enhance research, knowledge management, and knowledge translation in Kenya and in the region. Madam CS, I am equally humbled to recognize the presence of some of the greatest scientific minds as well as keynote speakers, Dr. Zulu Elijah, Executive Director and founder of the African Institute for Development Policy, Professor Frederick Chite Asira, CEO of International Cancer Institute, Eldoret, Kenya, Professor Kariuki Njenga, Chief Research Officer, KEMRI, Professor Lukoye Atoli, Professor and Dean, the Aga Khan University Medical College, Ms. Emma Orefua, Director of Programs, Africa for Global Action Fund for fungal infections, and finally, Dr. Benjamin Sofa, Principal Research Officer, KEMRI. I am also pleased to note that the conference will hold 3 symposia and 13 scientific sessions that reflect one of the central tenets of the KASH conference, which is provision of solutions to health challenges of our time, particularly COVID-19 pandemic. Ladies and gentlemen, the success of this conference, even though online, is a testimony that KEMRI fraternity has continued to grow in research and development portfolio, as well as in service delivery. It is an acknowledgement that we continue to respond to the ever-increasing public health challenges such as COVID-19 pandemic in Kenya and the region, as we endeavor to provide solutions to such challenges. I am humbled by the gains we have made since KASH conference started 11 years ago, and I look at the future with more confidence and conviction that we can only do better, both as an institute and as a conference. The resolutions from this conference will no doubt provide solutions for the various health challenges we face today. Therefore, I wish to urge our partners to support this great initiative that brings together great scientific minds in addressing health challenges of today, noting that these challenges have no boundaries. Let me thank our partners and collaborators for their immeasurable support and partnership. In conclusion, ladies and gentlemen, I take this opportunity once again to thank the Acting Director General of KEMRI, Professor Sam Kariuki, and the conference organizers led by Professor Charles Bogo, and all distinguished scientists and staff who made this conference a success. God bless you all, as I wish you all the participants a successful conference. Good day. Thank you.
Good morning, ladies and gentlemen. Good morning, CAS, Minister of Health, Dr. Mercy Mwangangi. All protocols observed. My great pleasure to this morning welcome our chief guest, Dr. Mercy Mwangangi, to give her introductory remarks. And thank you very much even for them, on behalf of KEMRI, for the Ministry of Health support during this period. Asante sana, welcome, Dr. Mercy.
Thank you. Thank you to all the organizers. Thank you. Thank you to all the organizers of this KASH conference. One, for giving us this opportunity to be able to address you today. Special appreciation to the chair of KEMRI Board of Directors, Dr. Daniel Mbinda. He's now one of our thought leaders and partners in the Ministry of Health, and we appreciate you, Daktari. Appreciation to Prof. Sam Kariuki, who has continued to support us, not just for the COVID-19 pandemic, but also as the Acting Director General of KEMRI. Thank you so much. The Chairman of KASH Conference Organizing Committee, Charles Mbogo, all key plenary speakers, our keynote speaker, who I'm informed is a great scientist, Dr. Zulu Elia, and all other distinguished scientists and participants, ladies and gentlemen, good morning. I'm extremely delighted to join you this morning for the opening of the 11th KEMRI Annual Scientific Health Conference, KASH. And let me take this opportunity to really sincerely thank the KEMRI management for successfully organizing this important conference, which is in its 11th year. I'm especially proud to join you today as the Chief Administrative Secretary, and having noted that this conference really has gone beyond expectations by drawing close to 74 abstracts drawn from different research institutions and academia, as well as all the different sessions and symposiums and plenary discussions that we shall have today. Really just to tell you, congratulations, KASH, particularly the organizing committee, for really making this possible. This is no mean feat, particularly when we look at the situation where we're coming from with COVID-19 pandemic and the world struggling with the new normal. And so really, I do acknowledge the immense contribution by the steering and organizing committee in making this possible. Ladies and gentlemen, it is often said that real leaders are forged in times of crisis and that every dark cloud has a silver lining. And this was evident not just for the world, but also for KEMRI during this time of the COVID-19 pandemic period. Let me extend the ministry's congratulations and appreciation from our cabinet secretary and all leadership when it comes to the role that KEMRI plays and continues to play in the COVID-19 pandemic. We take note of the inventions that KEMRI put in place, particularly the KEMRAB hand sanitizers, of which I have been one of the users, and I've actually purchased some for yourselves. The VTM, viral transport media efforts that were put in place in terms of making these innovations available in Kenya and also across the region. We do really commend that really innovative, great work by KEMRI. Now, as the foremost research agency in the Ministry of Health, KEMRI's work in response and containment of COVID-19 has been outstanding. From supporting the national COVID-19 surveillance, screening, testing, and bulk of all COVID-19 tests in the country to the technical input into the MOH COVID-19 task force, KEMRI has remained a key cog in the war against the contagion. KEMRI has also been offering technical advice across different levels on the COVID-19 pandemic, including modeling of trends and the COVID-19 sequencing in the country. And I really would like to just also extend my personal appreciation for this contribution. We've sat with different teams. We've really enjoyed, synthesizing and consuming some of the products that we've had some of the scientists from KEMRI give us, particularly as we make decisions on the management of this pandemic. And so I do appreciate you, KEMRI, for that effort. Distinguished participants, I'm also informed that drawing from your vast knowledge and experience over the years in dengue fever, Rift Valley fever, HIV, hepatitis B kits, you have recently completed the development of a PCR COVID-19 testing kit that is awaiting formal launch. And this is very encouraging, given that such a kit is not only cheaper to produce, but also can be deployed in our remote health facilities to help in community surveillance, as well as in mass screening for both symptomatic and asymptomatic cases. And allow me to pause here just to, again, appreciate the teams that have been working on this, to commend them, and to perhaps just, share with you all that perhaps one of the biggest lessons that we've learned as leadership through the COVID-19 pandemic has been the issue of self-reliance. And I do remember actually when this initiative on production of the PCR kit was initiated by Waziri, I remember him having a conversation with the teams in KEMRI in the office, and having some of your scientists moving back and forth with the kits, and us comparing the KEMRI kit to the Chinese kit to the American kit. I remember that time early on in the pandemic, and I must say, it's absolutely commendable. And there's no way a country can get to the point of self-reliance if we don't have the backing of scientists like yourself when it comes to innovation, but also when government puts in place that trust and investment towards scientists like yourselves. And so for this, we appreciate you, and we do then affirm our commitment to continue supporting such efforts and extending them even beyond COVID-19 into other disease group areas, such as malaria and other key strategic programs within the country. Another encouraging development from KEMRI is on the COVID-19 vaccine development global efforts. Other than your contribution in the initial research and clinical studies of Oxford, that's the ChAdOx1 study, and in the identification and development of local COVID-19 vaccine candidates that will significantly contribute to the control of the disease in Kenya. We do know there are ongoing efficacy trials of COVID-19 drug candidates, including also the screening of natural products. And really, again, here it's to appreciate KEMRI's workings in terms of trying to partner and collaborate, with different institutions such as Oxford, with different, bilateral, should I say, agreements. And really, again, I think Waziri and I were able to visit KEMRI Kilifi again early on into the pandemic, and we were able to meet a great set of scientists who have been working on different other vaccines and who are now trying to deploy past learned technologies in terms of trying to understand, the workings of ChAdOx and how that would be useful for us. Again, amazing, brilliant minds that we met, and really to just continue commending the work that is ongoing at KEMRI. And therefore, it is fitting, I think, after sharing with you all the experiences and all the great innovations that KEMRI has been able to put in place, it's absolutely fitting that the theme of this conference, the 11th KASH conference, should be strengthening health systems in Kenya through research, pandemic preparedness, technology, innovations in the post-COVID-19 era. And it's equally rewarding to note that the conference has beaten the COVID-19 pandemic odds by the number of abstracts being presented, as well as the record 13 scientific breakout sessions. And at this point, I'll steer away a little bit from my prepared speech and just sort of cursorily just talk about the program. I was able to look through the different, parallel sessions that you'll be having, and I can tell you each and every one of these is so significant, particularly at a time like now in the country. When I look at today's first session on pandemic preparedness, surveillance response, and travel medicine, I can tell you with the ministry right now, there are efforts to be able to consolidate all the lessons that we've learned in the past year when it comes to pandemic preparedness. How does a country have an adequate framework system that is able to actually be ready for the next pandemic? And there are efforts underway right now, and this is why it's absolutely crucial today as you have these discussions. I would hope Mr. Mbinda and acting DG, Mr. Kariuki, you'd find a way of synthesizing all the discussions from today's conference and tomorrow's conference and really sharing them with the ministry. Because right now we are at the crux of trying to set up what we are calling KCDC, which will be an institution that will come in to be able to support pandemic preparedness. And therefore, it will be interesting to hear the deliberations of this first scientific session 1 on pandemic preparedness. And when I jump into the second, just to show you how relevant your program is, adaptive and resilient health systems. This is something that we are in high gear in terms of discussion in the country, particularly when it comes to UHC, when it comes to primary healthcare and trying to set up systems in this country that will actually cause our systems to be resilient. And I dare say there are even discussions right now in terms of how do we measure true resilience of a health system? What is that matrix that we can say that this system is now truly resilient? Again, when we look at drug and vaccine development, Dr. Binda, I know you're in the steering seat there and you're doing an excellent job in trying to at least get to the first step of having a fill and finish type of setup here in Kenya. Then in comes the next question: how do you expand these facilities to go beyond the reconstitution of COVID-19 vaccines to other vaccines and perhaps even to other medications and commodities such as insulin, which we know is quite important and we've struggled with in the region in terms of ensuring that the supply chain is adequate. Again, infectious diseases cannot be understated, and these remain useful, particularly now as we deal with the pandemic. I see a lot of research and a lot of discussions when it comes to integrated cancer management. Again, something that we're looking at in the ministry, particularly at policy level. How do we integrate some of our strategic programs so that we can avoid duplication and leverage on efficiencies? Discussions are underway in those spaces. Again, sexual, reproductive, adolescent, child health is very big, very important. You may be aware that we currently have finalized our reproductive health bill in the country, and we're planning to put this to our parliamentarians. And there's some key elements within it, touching on very, should I say, nuanced elements in our system, things to do with IVF, elements to deal with surrogacy. And so really, we would really benefit highly from the contribution of all the scientists who are here today. And your discussions are very, very pertinent to the work that is ongoing within the Ministry of Health. I would like to also then congratulate the KEMRI team for their upcoming launch of the Cochrane Review Kenya chapter. Knowledge management remains crucial, absolutely crucial to the country. Often in the ministry, we have sometimes become a little bit exasperated when we're trying to put together certain policy imperatives, and we're struggling with sort of trying to collect all the knowledge that exists in those areas. And so I do see an opportunity for us leveraging on this launch of the Cochrane Review Kenya chapter. It is my hope that all the findings and recommendations which will be presented in the next 3 days will contribute directly to the national discourse on health, research, development, not only in Kenya, but also across the globe. Distinguished scientists, health is indeed the cornerstone for the comprehensive development and well-being of people and a hallmark of national prosperity and social progress. And so, besides the pandemic, I do note with satisfaction that KEMRI is addressing key pillars of UHC as championed by His Excellency the President, Uhuru Kenyatta, by redirecting its resources to provide solutions to the health sector. Among the presentations in this conference that are relevant to this pillar include also the governance of health systems, both at national and county levels. And really in future, perhaps for the 12th conference, I'd be keen to see a spotlighting on the county experience. A lot is happening in the county spaces, and it would be great to see how we can partner and encourage more young scientists to really present to us their workings in the county governments. That would be a really good lens in terms of trying to ensure that that collaboration is there and that we're actually having cross-learning from the 2 levels of government. Distinguished scientists, the true test of research is whether people use it, and for reference and for influence, and most important, for policy change. And it is my hope, therefore, that KASH will provide decision makers, opinion shapers, and practitioners access to a wide range of new and exciting research outputs, offering an evidence base that they can draw from. And with these few remarks, ladies and gentlemen, it is now my pleasure to declare the 11th KASH conference officially open. Thank you. And over to you, Chair.
Thank you so much, Dr. Mercy Mwangangi, that we are actually greatly honored for you gracing this occasion and opening our 11th KASH conference. We will be taking a break for a short period of about 10 minutes, 15 minutes, and then come for our main talk by Dr. Zulu. So please make sure that you don't log out and come in within the next 10, 15 minutes. I would also like to thank all the other people who have been here, including all of you who are the 117 participants who have joined online, those who are there in persons. I would like to thank our board chair and the other board members who are here. And I've seen many people who have joined, both from the media, from the ministry. You are all welcome. Please stand by for the next discussion in the next 10 minutes. Let's make it at 9:40. Can we be here and then by 9:55? We can start the next meeting by 9:55.
Okay, thank you, Chair. I just come to just give that brief for the next session because we already have it on the program. The speaker will be ready at 10:10. It would be nice for to probably join maybe 5 minutes or 10 minutes before. We've probably allowed you a longer break so that we are able to keep on the schedule. Thank you very much for your participation. We'll see you at 10:10 exactly to open the plenary session. Thank you.
Medical innovations start with the ideas and visions of committed scientists. Successful innovations then evolve over time, not within weeks or mere months, but years, as they graduate through different stages of development that entail basic research and clinical research. The Kenya Medical Research Institute, KEMRI, has in a similar manner grown step by step from its humble beginnings in 1979 to become a world-renowned medical research institution. In this respect, the development of its physical structures as well as manpower were carefully designed to respond to the most pressing medical issues of the time as it developed its capacity. As KEMRI came of age after acquiring a critical mass of highly trained scientists, its research programs expanded to meet the challenges of the emerging and re-emerging health problems. So, the Institute reorganized its research programs into 6 thematic research areas as follows. 1. Biotechnology Program. 2. Natural Products Research and Drug Development NAPREDA Program is a Vision 2030 flagship project. 3. Infectious and Parasitic Diseases Program. 4. Public Health and Health Systems Program. 5. Non-Communicable Diseases Program. 6. Sexual, Reproductive, Adolescent and Child Health Program. Each research program is composed of a multidisciplinary group of experts drawn from local and international universities and research organizations, government agencies, institutional collaborators, and KEMRI itself.
KEMRI has established itself as a leading institute of research in the region and worldwide. To that effect, we actually have had to develop our human capacity both in research and other supportive departments, as well as build on the laboratory capacity to be able to diagnose and offer the necessary services that research so much embeds itself in.
In KEMRI, we have been able to cover all the spectrum of healthcare that we can be able to provide to Kenyans.
Research conducted by KEMRI has shown that out of 1.6 million people living with HIV virus in Kenya, 900,000 are on antiretrovirals. Although ARVs have reduced AIDS, related morbidity and mortality, they have resulted in HIV-1 drug resistance and emergence of new strains whose virulence is yet to be established. Through the research centers in Busia and Nairobi, KEMRI have established the first ever HIV genotyping program in the country. Interestingly, the CVR laboratory has identified new and evolving HIV genotypes in Kenya, including the very rare subtype O, HIV2, and a myriad of recombinants. Perhaps the greatest clinical impact of KEMRI has been its contribution to HIV drug resistance testing in Kenya. Information from this study is expected to assist in the designing of vaccine as well as helping in making decisions on the change of treatment regimen, among others.
It was initiated ARVs 2005, and I've been on ARVs for the last 2005 to date, that's almost 12 years. And those 12 years has done it has actually been very helpful to me. I've actually seen my children go to school up to in the university. And then I'm seeing right now at the age of 52, and I got infected at the age of 28.
United Nations HIV program basically targets that by 2020, 90% of people who are HIV infected know their HIV status. 90% of those who know their status are started on medication, and 90% of those who are medication are suppressing the disease.
From 1984 to date, the center has been able to achieve quite a lot in terms of advising the policy in this country and world over, because that is our main mandate.
Similarly, in order to better understand how the body responds during the critical moments of early HIV infection, the Kericho site of KEMRI is also participating in an innovative study focusing on the earlier stages of HIV infection to help understand what is needed to create an effective HIV vaccine. The interventions used include very early broadly neutralizing antibodies, which are substances produced by the body to fight infections.
Okay, I want to welcome you back to this session again. I just want to inform you that we'll continue keeping our mics muted. I want to welcome back our chair, Dr. Mkoe, to proceed with the second session of this conference. I think our guests are all ready and we'll be able to proceed. Thank you very much.
Much, Vera. The next session will be actually an address, it will be an opening keynote address by Dr. Zulu Elia, entitled Strengthening Health System in Kenya Through Research, Pandemic Preparedness, Technology and Innovation in the Post-COVID-19 era. Now, Dr. Elia Zulu is the Executive Director of the founder of African Institute of Development Policy, AFIDEP, whose mission is to transform lives by enabling a culture of evidence-informed policy formulation and implementation in the public sector in Africa. Zulu has extensive experience in research, capacity building, and policy engagement on population change and sustainable development, urban poverty, reproductive child and maternal health. He is the former president of the Union of African Population Studies and has served on many international development panels, such as the UK Royal Society Study Group that produced the 2012 report, People and Planet. Zul has given various keynote addresses, including at the UN General Assembly. He is a leading program to translate evidence to support Africa government, determine strategic investment to enable them harness the demographic dividend. A truly international scholar, he earned his PhD in demography from University of Pennsylvania, a master's degree in population and development from Australian National University, and a Bachelor of Social Science in Economics, Applied Statistics from University of Malawi. Welcome, Dr. Zulu.
All right, thank you very much, Dr. Let me just open my slide here. Oh, is it open? Am I the one sharing? Let me see. Okay. Hi, good morning, everybody. I suppose that you can see my screen. Is that all right?
Yes.
All right, thank you. So I'd just like to start by acknowledging all the dignitaries who are there, in particular noting our chief guest, the administrator from the Ministry of Health, the Acting Director General for KEMRI, Professor Kariuki, Chair of the Board for KEMRI, the organizers of this very, very industrious conference, and all participants. I'm really honored to be here to speak at the beginning. Was one of the speakers in this opening session for the conference, which has really chosen a very, very fitting theme of strengthening health systems in Kenya through research, pandemic preparedness, technology and innovations in the post-COVID era. So I'm going to start off in my talk by talking a little bit about the organization that I lead, AFIDEP. And that's not to do marketing for the organization, but because I think the way the organization is set up kind of speaks to the theme that that the conference is focusing on, but also it kind of poses a challenge to all of us, especially the researchers, on how we can make sure that we, in the Cabinet Secretary's statement that was read, that the point about making sure that evidence is not just, research is not just being done for the sake of research, but it's being done, that there are efforts for us to make sure that the research is being used. So that's what AFIDEP really stands for as an organization. We are a Pan-African Research and Policy Institute that we just celebrated 10 years of existence last year. But our main aim is to bridge the gaps between research, policy, and practice. I think when you really look at the question on, to what extent is research transforming people's lives, I think you need to make sure that there are deliberate efforts to bridge those gaps between research, policy, and practice. And one critical thing we need to note here is that if we look at, say, the last 20 years or so, my PhD more than 20 years ago now, over this period, I've seen firsthand how African countries, and Kenya being one of the leading countries in that respect, how African countries have really enhanced skills in knowledge generation. A lot of PhDs have been done, a lot of research is being done by Africans ourselves, but also by a lot of northern universities, research centers that are all over Africa, and Kenya, no exception, a lot of research being done. But to what extent is this research informing decisions to improve health systems and health outcomes is a question that I think we are grappling with, and the answer has to be obviously that this is not optimal. So our vision at AFIDEP is to see an Africa where evidence is used consistently to transform people's lives. We enable the use of evidence in the design, implementation, and development of policies and programs. And so that's really the issue. I think when you look at evidence use, you can never say that there's any policy in the ministry or in the public sector that doesn't use any evidence at all. I think what we are talking about here is really maximizing or optimizing use of evidence, making sure that the use of evidence is not sporadic, but it's consistent. Every time decisions are being made at all levels of the policy-making cycle, whether it's priority setting, it's a choice of interventions, it's how to improve performance of programs, and resource allocation, how much money should go to malaria versus HIV versus other interventions, child health, and so on. What evidence are we using? And I think when we talk about making sure that there's a culture of consistent evidence use, it means that our approach to making sure that we as researchers, the way we engage with government, even within the government itself, how do we make sure that the data, for instance, in the DHIS2 system is actually being, the quality is improving, but also it's being used on a month-to-month basis to make decisions. If we go by the fact that we want consistent use of evidence in decision-making, we have to then know that we have to make investments at individual skills level, at institutional systems level, and I'll be talking about some of these things as we talk about the theme. So our broad strategies at AFIDEP are three. We do individual technical capacity strengthening, where we do individual technical capacity research in research synthesis and evidence use. We optimize institutional capacity for evidence use. But we also do advocacy to make sure that the evidence that we generate is actually being used systematically in decision making. The way we generate evidence as a research organization, we do a bit of primary research, but our main aim is to do translational research that responds to urgent policy and program questions. to make sure that the research that is being done responds to the needs of policymakers, rather than researchers sitting on our own doing research and at the end of the research going to try to disseminate the research, but trying to do evidence-driven research. So that's what we do, and our theory of change is basically, this summarizes what we do, the outputs, and what we are trying to change mainly through this approach is to strengthen the part that has medium-term outcomes, political commitment and enabling policy environment, to strengthen that for improving health systems, for improving health outcomes, and so on. We want to improve design and implementation of effective development programs, and we want to improve budget allocation and priority setting. And we believe that if we use evidence consistently, those are the main things that will change in the health sector, and eventually what we'll see will be improved health service delivery, will be improved addressing the inequities, reaching out the last mile, the people who are behind. And our 5 main areas of work, which revolve around the SDGs, are health and well-being, population dynamics and the demographic dividend, transformative education and skills development, environment and climate change, and then we have governance and accountability. And all these things are revolving around the meeting as we go forward. So now, let me try now to link that.
Dr. Leah?
Yeah.
Yeah, you can just put on presentation mode.
Oh, it's not on?
Yeah. Sorry for interfering. Yeah, thanks.
Sorry, I thought I've been sharing all along. I've been moving my slides. That's...
It's on, but it's not on presentation mode. Just at the bottom.
Okay.
Yes,
Sorry.
thank you.
All right. I thought it was not
Thank you.
showing.
That's it.
So
That's it.
I was gonna panic a little bit. How do I remove this? Okay. So, Kevin, how do I move? Okay, all right. I think when I put it in presentation mode, I kind of lost the scroll button there. So yeah, so now I'm getting back to the issue that we are talking about. And I think a good starting point is to note the message that the CS message said that Kenya has made progress, tremendous progress in strengthening its health systems as reflected in improving health indicators. Kenya is one of the star performers, of course, in Africa in terms of the extent of research and the steady progress that has been made in improving the health systems. These are some of the indicators. We know that life expectancy now at around 66 years, maternal mortality ratio, although very, very high, has been going down. Births attended by a skilled birth attendant. So the indicators are showing a positive outlook, but there are areas, of course, where we know that if you look at this chart that is summarizing the trends in maternal, neonatal, infant, and the 5 mortality rates. So we had that stored progress in maternal mortality between 2003, 2008, but we've seen quite a big drop since then. And I think we should expect maybe even a bigger drop when the next DHS is done, given the Safe Motherhood program that both the President and the First Lady have been championing, the free maternity care policy that came up a few years ago. So I think the key message to note is that when there's political will to do something, when the government, from the highest office in the land, the president can make a decision to say, we can't continue looking at our mothers dying the way they are doing, and let's do something about it. Often, we see improvements, whether it's family planning, whether it's HIV, whether it's maternal health. We've seen that political leadership is very, very critical. So it's good to see, and I think we are all looking forward to seeing a bigger drop there. So the other charts, the yellow one is showing under 5 mortality. That has had this steady decline over the last sort of 15 years or so, going to 2014, as well as infant mortality. But there are those two ones that are the middle one there, the neonatal mortality. that's where we are seeing the least sort of progress, children dying within their first month of life. And I think that's where the focus needs to be if Kenya, which now being a middle-income country, we really, when we compare ourselves with what the under-5 mortality rate should, is, and celebrate that we've moved from 120 to almost about 55, we have to note that the other countries that we are benchmarking ourselves in Vision 2030, like Malaysia, Thailand, they are below 10. So we've made progress, yes, but there's still a lot of work that needs to be done for the country to be where it needs to be. Yes, we the country, when we look at the Big Four agenda, to have health as one of the critical 4 development pillars that the government, President Kenyatta's government has undertaken, was a very, very big milestone for the health sector. But I think we need to keep asking ourselves the question, to what extent have we in the health sector, experts, scholars, researchers, and so on, and practitioners, to what extent have we taken advantage of that declaration to really move forward the health agenda? Whether it's working with NHIF in finalizing the essential care package, have we made sure that that is really, taking care of those, especially who are the most vulnerable, the poor people, the youth who are most, the hardest to reach, and so on. So, yeah, we're making progress, but the challenges in the health system in Kenya are persisting, and these are some of them. The quality of healthcare in the public health sector remains relatively poor. We see frequent strikes by nurses and doctors. I think we have to ask ourselves the question, to what extent are we taking care of the frontline workers? Especially in the light of COVID now, we've seen how, I think towards the end of last year, beginning of this year, we lost a lot of doctors. And so I think the issue about taking care of doctors, making sure that the issues that cause them to continue going to the streets instead of strengthening the health systems are addressed. The health workforce in terms of deficiencies and the number of experts in the system. The fact that only 16% of Kenyans have access to health insurance is really a very, very big problem there. And I think for a middle-income country, these are some of the things that Kenya needs really to start looking at addressing. And for this to happen, it requires everybody to really provide leadership, not only looking at the political leadership at the president's level or at county level, but we have to look at parliament. But we as researchers also have a role to play to continue demonstrating the importance of making sure that these challenges are addressed. And the one that we deal with mostly at AFIDEM, as I have said, are making sure that there is consistent use of evidence in decision making. Healthcare financing has gone up over the years, but also we have to note that the number of people that Kenya, the population is growing very, very rapidly over time, approximately 1 million people. So when we are looking at this increase, we see that the health sector is very, very grossly underfunded. There was a time I was chatting with a member of parliament in the health sector who was asking me, that was the time when everybody was talking about we need to increase funding for the health sector in the counties. And he asked me the question, but Daktari, what is the optimal funding? What should we be aiming at? Is it per capita funding? Should we define a threshold for per capita funding that all county governments should aim for, or what? So I think these are the areas where we as researchers, we can, of course, say we need more money, but we need to start illustrating what are we able to do in terms of saving people's lives with the current funding? And if we increase the funding, what will we be able to do that we are not able to do now? And what gains are we going to have in terms of improving healthcare? But I think one critical thing in that chart also is just the fact that out of this funding for the whole health sector in Kenya, there's still quite substantial dependence on donors. And of course, there's the private payment, which is in the middle. So the public has been going up, yes, but not to the not as much. And I think as as a middle-income country, we are going to increasingly start receive less aid, donor aid, and so on. So the public needs to increase, the money from the public sector needs to increase substantially as the donor monies are going to be drying out. So now just settling in on the issue about COVID. We know COVID-19 has been a very, very big problem, not only for health, but for social, economic well-being. People have lost jobs and so on. But I think one critical thing that COVID has demonstrated is the central importance of research. It's one development issue where everybody was looking at the numbers. What are the numbers showing? When the president wants to address the nation, he's looking at the numbers. What is the positivity rate now? How many people are we losing, and so on? So I think it's a catastrophe, as we have seen, in terms of the disruption it has caused, the loss in lives, and so on. But I think when you looking at this as well as an opportunity for the health sector, are we using it to help now get more attention to things, to issues about health system strengthening that have been overlooked for decades? In terms of tracking of the epidemic, the pandemic itself, in terms of now making sure, I mean, I've gone to Rwanda maybe 3-4 times during this COVID period. There are biomedical center that stores COVID data. I mean, I go online, I put my phone number there, I see all the tests I've done, and my certificate for COVID vaccination that I did there is there. I can just print it. I think we can move in that direction as well in Kenya, just to strengthen, to learn from COVID, to see how we can strengthen these systems. So the issue about achieving universal health coverage and pandemic preparedness, we know that research and innovation are crucial for defining the interventions and services needed to achieve universal health coverage, but also more critically monitoring service coverage, financial risk protection, and health impact to ensure equity and monitoring the quality of services. But for the pandemic preparedness in terms of COVID, documenting and drawing lessons from what has happened in previous pandemics, addressing the multifactorial nature of pandemics. It's not just health. Some of these issues are going to have long-term impacts and so on. How are we responding to that as researchers to make sure that, yeah, we accept that maybe we may not have been as ready as we should have, as we needed to be when COVID hit, but how are we now adjusting to make sure that we are more ready as we go into the future? The issue about vaccines for pandemics, I'll be getting into that in a little more. But I think the other critical thing we need to note when we look at Kenya, Kenya is a role model for many African countries. Sometimes as people, many of us who live in Kenya, we sometimes take things for granted. We just have to go to a number of, even some of the neighboring countries, to see the strength of the progress the country has made. Having KEMRI as a specialized, medical research institute, there's NACOSTI that is looking at research more generally, the National Research Fund, the research regulatory frameworks, and we have the health policy. So the structures are there in terms of moving the country forward. I think what we really need to look at is how do we bring the efforts from different institutions that have been put in place and see how we can optimize them to work together to strengthen the health systems. And we know that a big problem related to a big stumbling block or bottleneck related to the effectiveness of all these processes that we have is inadequate funding and staffing, weak systems and incentives to enable demand and use of evidence as well, but weak institutional and individual capacity to plan, to make sure that things are moving forward. And so as we think about, this conference now as researchers, we need to think about all these challenges and how we can also start refining and reformulating our research to respond to how we can help address these challenges. So I'm going towards concluding this really by highlighting that there's urgent need for the government to match the investments of its development partners in strengthening institutions, structures and processes that facilitate research use, innovation, and basically application of trying to work in a multi-sectoral way to make health the central part of the development process in the country. Leadership is very, very critical. We started a project at AFIDEP called Health Technologies that my colleague Dr. Rosa Ronje is leading. And what this project is trying to look at is, if you look at over the past 2 decades or so, there's been hundreds of millions of dollars that have been invested in developing what you might call transformative health technologies, like the use of drones to deliver medical supplies to hard-to-reach areas, genetically modified mosquitoes. So things like this have been developed. Many of them have potential to transform healthcare delivery in Africa. But for the most part, they are drowned. Now, some of them are heavily criticized. Some of them, you know, they have never really moved from the lab to be scaled up. And partly, part of the problem is also that many of these don't have regulatory frameworks. They are very different from normal medicines like vaccinations, like antibiotics and so on, which already have mechanisms for regulating how they get used. But when you look at these technologies, so we're trying to say, okay, to the extent that these technologies are safe and they can actually help, can we as Africans have a bigger say? Can we get involved more? Because now many of them are being developed from the north, just coming at the tail end for us to use them. How do we optimize our involvement in them? So I think this is a critical thing. We did a landscape analysis of this for Kenya as part of this project. And the conclusion was that while Kenya has a good research infrastructure, which I've talked about quite a bit, for supporting the development of health technologies, much of these efforts remain at the lab stage with no scale-up to commercial production due to lack of funding and weak political will. And in that respect, actually, you have to ask yourself the question, you know, why, when you look at COVID, for instance, the CS statement, the administrator emphasized the issue about the innovations that KEMRI has come up with over the years in research, a lot of the treatments. Now you've come up with the COVID PCR test tool. I think the point is, Kenya, given its economic stature and its leadership in the region, it needs to get into serious business like India is doing in manufacturing of medicines and that sort of thing. So we don't have a whole continent on its knees waiting for, you know, when India will open its gates for us to get more vaccines for our people. So we really need to move towards a new era where we know that with emerging health problems such as COVID-19 pandemic, persisting health issues such as malaria, TB, non-communicable diseases, and so on, we need to invest and provide more political leadership and technical leadership, of course, in developing technologies and optimizing innovations by funding our own research institutions to be at the forefront in leading, not only in teaming up with our colleagues from the north, but in actually leading this work and having that government support that if we come up with these products, we patent them and we develop, we bring them to scale in terms of production. So yeah, it's that question about vaccines that I already talked about. So we've had this long history of conducting research to test vaccines. COVID-19 presents a huge opportunity for Kenya to take leadership, but this, as I said, it needs more political will. And we have to ask ourselves now, I hope that a lot of the papers in the conference are going to talk about this. What have we learned from COVID-19 and how is this going to inform how we move going forward? I mean, some of the critical issues we need to be thinking about this. Now there's a bit of talk now about what is being called long COVID, that the debilitating symptoms from COVID can last past months and months beyond the course of the disease. But there's limited evidence on the prevalence and manifestation of long COVID, for instance. So how do we come up with a research agenda that will be informed not only by what we as scientists think, but also we have the health workers themselves, the patients and the carers, so that as we think about COVID, we are not just thinking about this COVID where we are counting the numbers of who is positive and how long, and we are also thinking about these long-term impacts on the health side, as well as socioeconomic, mental aspects of COVID. So as we reflect on COVID-19 and the possibility of future pandemics in relation to our health system, the conference, in my view, needs to answer this question. What evidence, technologies, and innovations will Kenya need to invest in to successfully tackle the next pandemic? And not just the next. I think COVID is still very much with us. I think we are still mainly, focused on the biomedical aspect of it. But when we go to these other socioeconomic aspects, mental issues, there are very, very big gaps there. So I leave that question with all of us here to say, let's really think, and by the end of the conference, set up a new agenda on how we move forward as a country to really address the challenges. Of course, celebrating the achievements that we've had over time. We know Kemri, for instance, has made a lot of progress. They have set up this knowledge management unit at Kemri. There's the research unit at the Ministry of Health. But I think the interaction between the two, especially when you even go to the county governments, is still very weak. How do we optimize that so that we actually achieve a culture where decision-making, at priority setting, at choice of interventions, at resource allocation, at monitoring and improving performance, we put evidence at the center of the health delivery system. So I think we can do it, and the conference will set us on that path. And I thank you, Madam Chair, and everybody else for listening to me, and all the best. My talk ends here. Thank you.
Thank you. Thank you so much, Dr. Zulu. I think within those few minutes I've earned a PhD. I don't need to go to school. I've learned a lot. And I know there are not, if there are any questions, please just put in the chat. We can send. We usually do not question the keynote speakers. But I feel like putting just a few comments that of what he has put forward. One is that it's not all doom, but there's some light. And we should use prudent use of the funding is very important. But actually increasing funding, because we have the brains. If we increase funding, I think we'll go far. I was disappointed that natal mortality has stubbornly remained low, and I'm a pediatrician. I don't know that the problem is me or is the gynecologist and pediatrician and the people there. So we actually, and also that we need to work very closely with other people. I know knowledge management are coming on board. There's something they're doing in the counties. I hope they can increase it. The discussion we've been having with the Minister of Health in Zioka, Karaoke, Wamisi, I think we have been challenged. We are not doing as much, so we should try to come together a little bit more. So thank you so much, Dr. Zulu. We will now move on to the next session, which will be headed by Professor Obonya and Professor Orwa. They'll take over and lead that session. Welcome, Professor Obonya. Professor Obonya or Professor Orwa, please take over the sessions on the Cochrane Knowledge Management launch. Cochrane Center.
Now I can mute. Good morning.
Okay.
Good morning. While we are waiting, Professor Obonyo, most welcome to this session of launching Cochrane Kenya. I would like to, first of all, say that we are very pleased. All the presenters have really commended the introduction of Cochrane Kenya, and particularly being hosted in the Institute. I would like to thank Kenya Medical Research Institute for allowing us to do all this. And we have already heard of the benefits. I don't really have to mention that. When Professor Ubonyo comes online, he can give some speeches. I am requesting Professor Charles Wisonge, if he is around. He's going to be our keynote speaker in evidence-informed healthcare, the role of Cochrane collaboration in health decisions. Professor Charles Wisonge, kindly let us know if you're on board, you join us. Is there? Professor Wisonge?
Just give him like 1 minute. Professor Ubonyo is joining.
Thank you, thank you. He's coming. Hello, Professor Ubonyo, you are online? He's not. Hello, hello?
You've been unmuted.
Oh, he's been talking and muted.
I have now joined. Good morning, colleagues.
Okay, try again, Professor Ubonyo. I think you should be able to go on. He's unmuted.
Professor Ubonyo, please go ahead.
His voice is not active.
Prof. Ubonyo, you are unmuted.
His speaker is not active.
I suggest, like Professor Ora was saying, we can get the speaker, and then when Professor Ubonyo comes in, he can continue from there. Is that okay, Professor Ora?
That is fine, Mr. Chair. Charles Wesonge, you are muted. Okay. Charles Wesonge, join us now, please. Professor Wesonge, you have been given the right to unmute and talk.
Okay, thank you so much.
Thank you. Most welcome.
Thank you. Would you want me to do my presentation? I probably need to be given the rights to share. Okay, I now have that. Thank you. Give me 1 second.
Charles, you can go ahead and share.
Can you see my slides? Are they displaying well, or are you seeing the presenter mode?
Presenter mode. All right,
Okay.
thanks.
Okay. Okay, thank you so much for giving me the opportunity to talk here. I know you've given me 2 hours to talk, but if you don't mind, can I use only half of that time? And then we can discuss, and if there are any comments before that. But if you want to give me the 2 hours, I can talk.
No, Professor, you have half an hour, no problem, because we do have a different session after your talk.
Okay.
Thank you very much.
Thank you. Yeah. So we all know that being a scientist here, that science consists in the creation of simplicity out of complexity. And that is why with us at Cochrane, our goal is to promote evidence-informed decision-making by producing high-quality, relevant, and accessible systematic reviews and other synthesized research evidence. We have our strategy that has just come to an end now, was called the Cochrane Strategy to 2020. And our aim then in that strategy was to put Cochrane evidence at the heart of healthcare decision-making everywhere around the world. And we had 4 strategic goals. The first goal was to produce high quality, relevant, up-to-date systematic reviews and other synthesized research evidence to inform healthcare decision-making. We also had some indicators on how we would know if we were successful. And this is for this particular one about producing evidence. We thought that to be able to see that we have succeeded by 2020, which just ended, the Cochrane Library would be the preeminent publisher of systematic reviews in the world, and that all Cochrane reviews published and updated represent the best methodological practice. And Cochrane is leading in the production and publication of new types of systematic reviews and other evidence products. And this work would be user-driven, so it would be the researchers and the users of evidence who would decide on the priorities, and that at least 80% of the high priority standard intervention reviews would be completed rapidly so that they can be used in decision making, and that people and processes are working better with technology in order to ensure that this evidence is produced and shared. Our goal too was to make our evidence accessible. So it's of no use producing all of this evidence and then it's not accessible to people who would need to use it. So to make Cochrane evidence accessible and useful to everybody everywhere in the world. And this is how, these are the success indicators that we set for ourselves, ensuring that this user-centered product development, that plain language summaries and abstracts are available in multiple languages with a focus on quality. And I'm hoping that with Cochrane Kina now that some of these abstracts will be available in Swahili. So the third goal was for advocating for evidence, to make Cochrane the home of evidence to inform health decision-making, build greater recognition of our work, and become the leading advocate for evidence-informed healthcare. And I'm very grateful that for the support that KEMRI and others in Kenya have given to ensure that we arrive at this stage where we have Cochrane Kenya. And we know that Cochrane Kenya is going to play a big role in advocating for this evidence and producing and also helping to make it accessible. And we are grateful for all the support that has led to where we are today with Cochrane Kenya. So our goal forward, building an effective and a sustainable organization. So aiming that Cochrane would be a diverse, inclusive, and transparent international organization that effectively harnesses the enthusiasm and skills of our contributors, is guided by our principles, govern accountably, manage efficiently, and makes an optimal use of available resources. And here, the indicators were that by 2020, the Cochrane, our organizational structure and governance, is optimally configured to support the mission and the function, to ensure that it's not a bureaucratic agency, so that everything, those structures, management and advisory, are there to ensure that the evidence that we produce is of high quality and that it is used, and that we can measure that impact. That our membership, because we have a scheme for ensuring that people join Cochrane, is implemented and is valuable to our members, and that roots into the organization are clear, because people can contribute to the organization in various ways. For Cochrane authors, they are well-known contributors, but people can contribute in various other ways, and we want to ensure that people, even if they don't want to be authors, or they are not yet ready to do Cochrane reviews, that they contribute in other ways. And that Cochrane, the aim was that by 2020, Cochrane would be far more represented in Africa and in other places that we are not very much represented. So it was mainly a UK organization, Europe, and a lot from other developed countries, Australia. But that the presence in Africa need to be felt. And we are here today because we are achieving that. The newest baby in the world, Cochrane Kenya, being there now shows that Cochrane is more represented in Africa, and we want Cochrane Kenya and others to help us to ensure that we are more present everywhere and in more countries. And we support the people that contribute to our work and produce our products in their professional development. I just want to use 2020 and just see for the Cochrane production of the reviews to just show how Cochrane was able to help in evidence-informed decision-making, being there when they are needed to help in producing the evidence that makes an impact in people's lives. So various at Cochrane special collections were published on various aspects of Cochrane. There were weekly citizen scientist challenges, and we can send more information about this for people who are interested. There were at least Cochrane reviews that are published. Usually it used to take a long time to produce a Cochrane review, but this time methods have gone very fast and we're able to publish this. And there were even more rapid non-Cochrane reviews that were used, and I'm sure that some were produced in Kenya to help in decision making. And COVID evidence was published in up to 13 languages. And Cochrane Library had a supplement building where a lot was put in there with various aspects of Cochrane or of COVID, where evidence of various aspects into the supplements that were produced during the year 2020. And in 2020, Cochrane published 505 new or updated Cochrane reviews and protocols. And knowing how difficult 2020 was, with people occupied with various activities, this shows how Cochrane contributes, including our colleagues in Kenya who are present here on this call, and those, even though some of them who are not available today because they are committed for on other things, contributed to all of this to ensure that Cochrane produces the evidence when it is needed. And the Cochrane Library, being researchers, of course, impact factors are very important. So there is the Cochrane Library has had a sustained increase in impact factor for the Cochrane database of systematic reviews. It was 5.6 in 2009, which was quite high, to 7.9 in 2019. And when the new one comes, it's probably going to be much higher again. It was a highest cited medical journal with more than 67,000 citations in 2019, and even more in 2020 as we're going, when we get the data available. The Cochrane database of systematic reviews was the 10th out of 165 journals in medicine in the general category. And there's an increasing number of included studies in Cochrane reviews, and it is highly used, millions of accesses. And like we said in our producing evidence, we used to produce only intervention reviews about the effects of interventions, like Eleanor Ochodo would know more than me and can tell us is we have diagnostic reviews that are being produced, and people like Dr. Ochodo are the leaders in this field. And there are also various methodological reviews and network meta-analysis that are being produced in Cochrane. And our users actually read this work very well. Cochrane Library users from various surveys that have remained quite satisfied, very likely to visit again, and are strong promoters of our work. So all of this work is done by this global network of Cochrane contributors, including those in Africa, in South Africa, in Kenya, and other African countries. And there have been a growing number of contributors. Here I'm only showing the authors, and those circles are supposed to show the number of authors as of the moment in various countries. And you will see that the leading countries in Africa in terms of Cochrane authors, and they're not and this is in addition to other types of contribution to Cochrane. We have South Africa, Nigeria, and Kenya, and we are very grateful for this, and that all of these contributions to Cochrane have now culminated in Cochrane having a presence, an official presence in Kenya. So Cochrane Kenya is welcome, and we know Cochrane Kenya is going to make an impact not only in Kenya but around Africa and globally. So Cochrane, it is the structure. This is how the Cochrane structure looks like. The things, the ones that are in blue, I will just focus there where we have the Cochrane production, the reviews, and the review groups are under. They have been grouped into review networks. There are methods groups under the editor-in-chief, and we have geographic groups. And under these geographic groups, we have networks like the Cochrane Africa Network, centers, the South African Cochrane Center, and associates and affiliate centers like Cochrane Kenya, and various other groups that are involved. And in 2017, we launched the Cochrane Africa Network with a lot of contribution from, and you can see from these pictures, some of the colleagues from Kenya who were there. So it's a network that is a combination of the work by the various contributors that I mentioned, and with a lot of contribution from Kenya. We launched the Cochrane Africa Network, and this is just showing the timeline to that, which about 10 years to formalize this structure. And our current concept is that the Cochrane Africa Network would help in with the various hubs around Africa in coordinating Cochrane activities. And we know that Cochrane Kenya is going to play a big role in the coordinating role in the Eastern Hub, and we're collaborating with the others as shown on this on this slide. And this would ensure that we increase the use of evidence to inform healthcare decision making in Africa. During in terms of evidence-informed decision-making, collaborators in Africa as part of Cochrane Africa, including Cochrane Kenya, have helped in producing rapid reviews for various governments, both national and sub-national and other national stakeholders, producing rapid reviews for decision-making at WHO and other organizations. And just at one example, the key partnership that Cochrane has used for enhancing its role in healthcare decision-making. We have had collaborations with Wikipedia, and especially the World Health Organization. And in 2020, 86% of new WHO guidelines were informed by Cochrane reviews. And during the COVID pandemic, the Cochrane worked closely with WHO by producing rapid reviews to answer priority questions. We published 25 reviews on priority questions related to clinical management of patients with COVID-19 and public health measures to prevent transmission of the disease. These reviews are being regularly updated as more evidence becomes available. Various Cochrane groups, Cochrane Africa, produce about 20 evidence briefs for WHO regional office and various other rapid reviews. Regarding our work with Wikipedia, the Cochrane database of systematic reviews remains the most referenced medical journal in Wikipedia. As of January 2021, evidence from 53% of Cochrane reviews published in the past 10 years were being shared on English Wikipedia. These citations in Wikipedia receive over 51,000 referrals from Wikipedia to the Cochrane Library per year. Efforts to improve health-related Wikipedia in languages other than English have continued, and I think that it would be important, if it is not yet happening, that Swahili and other languages spoken in East Africa should be part of this initiative. And now I've talked about the Cochrane strategy to 2020. Now 2020 is over, so these are our 4 strategic goals going beyond from 2021 and above. Not only producing evidence, but producing trusted evidence. So trusted and timely synthesized evidence addressing the most important questions for health decision-making, informing health decisions, that's our strategic goal 2, to inform health decisions by making Cochrane evidence accessible and usable for those who need it. Our goal, strategic goal 3 will be advocating for evidence to be a leading global advocate for evidence-informed healthcare, both national and global. So we need to be present everywhere. And our strategic goal 4 is collaborating effectively to be an independent, global, diverse, sustainable, and well-run collaboration of members and supporters. And I know that in these strategic goals, Cochrane Kenya is going to play a big role, and we appreciate the support that Cochrane Kenya gets from KEMRI and other structures in Kenya. We thank our collaborators in Kenya. We thank the Cochrane Kenya staff, and we know that Cochrane Kenya could not have been born at a better time. So this is the time, and we count on Cochrane Kenya to help us in achieving these strategic goals. And I give you a proudly South African thank you, Ngiyabonga.
Thank you very much, Prof, for introducing Cochrane to us Kenyans. You have made our work easy in Cochrane Kenya, so we hope we will meet the expectations. I will request Professor Wisonge to show us his face, because I just want to introduce him. You will pardon us for doing the reverse presentations, but thank you very much for that informative presentation on Cochrane. Kindly let us see your face as I make a formal introduction. Professor Wisonge is the director of Cochrane South Africa, the South African Cochrane Center at the South African Medical Research Council. He is also a professor in the Department of Global Health at the Faculty of Medicine and Health Sciences, Stellenbosch University, South Africa. Professor Wisonge was previously the Deputy Director of Center for Evidence-Based Healthcare, Head and Knowledge Translation Unit, and Head of the Implementation Research Regional Training Center at Stellenbosch University, South Africa. His appointment prior to joining Stellenbosch University included Project Manager of the Vaccines of African Initiative and Chief Research Officer at the University of Cape Town, South Africa. Chief Research Officer at UNAIDS, Geneva, Deputy Permanent Secretary in the Central Technical Group in charge of the expanded program of immunization Cameroon, and medical epidemiologist at Center of Pasha du Cameroon, Yaoundé. Professor Wisonge's research interests include immunization, health systems strengthening, and knowledge translation, implementation science. He was knighted the President of the Cameroon with the National Order of Valor, the highest honor in Cameroon in the category Chevalier. Professor Wisonge, I hope I have pronounced that well. Congratulations for the accolades and congratulations for being our key speaker as we launch Cochrane Kenya. If Professor Obonyo is online, I will hand over the session to him, and after his talk, he can invite Dr. Elena to give us our last speech before we launch Cochrane Kenya. Professor Obonyo, have you enabled Professor Obonyo to, Professor Obonyo? You've unmuted him. Prof, how about Dr. Eleanor? Are you able to unmute? I saw she was complaining she couldn't unmute herself. I'll request Professor Obonyo or Dr. Eleanor to come on board in the session. Hello, hello. I know I saw Elena saying she couldn't unmute.
Okay, just give us a second. We are going to enable them.
Did Dr. Wisonge show his face?
Hello, Prof. Orwa.
Yes, thank you very much. Dr. Eleanor, if you are on board, kindly give us an overview of the current status of the evidence generation and synthesis platform in Kenya. Welcome, Dr. Eleanor Ochodo.
Okay, thank you, Professor Orwa. I need to share my screen first.
Go on video also so that we can see your face.
Yes, I'm on video now. Okay. Can you see my screen?
Yes. Yes, we can.
Just briefly introduce yourself, Dr. Eleanor. I know you're my colleague here, but kindly.
All right. Well, good morning, everyone. My name is Dr. Eleanor Ochodo. I'm currently an assistant principal research scientist based at the Center for Global Health Research at KEMRI and an honorary senior scientist at Stellenbosch University, South Africa. And I'm also a member of the African Academy of Sciences. This morning, I'm going to give my presentation on the evidence synthesis and translation platform in Kenya, just to give an overview of what is currently happening. My screen cannot just... Hold on, my screen is frozen. I can't navigate.
Okay, is it able to move?
No, my screen is not able to move.
Okay, sometimes you may have to get out of presentation mode.
Okay.
Okay, can you try again?
All right. Okay. Now I'll share my screen again. It's now moving. Can you see my screen?
Yes, we can.
All right. So I will not use the presentation format for now. All right. My presentation this morning will be as follows. I'll give a brief history of evidence synthesis activities in Kenya, then mention the main players, the scope of activities, and conclude by just highlighting the opportunities. Now, a bit of history. Systematic review, or rather evidence synthesis related activities started in Kenya under the University of Nairobi, mandate the Department of, or rather the Institute of Tropical and Infectious Diseases. Its aim at that time was to train a critical mass of systematic reviewers for Kenya. So they were quite integral in just starting off these activities in Kenya. KEMRI between 1998 and 2001 made attempts to establish a Cochrane review unit in KEMRI under the leadership of Professor Bonyo, but plans unfortunately dropped due to change of priorities at that time. I think at that time it was just a matter of timing. Evidence-informed healthcare had not really taken root, or people's rather lack of understanding about its importance, unlike right now. There are a number of scientists in Kenya, initially trained under Cochrane South Africa. The biggest collaborators in Kenya so far have been Cochrane South Africa, the Makerere University, specifically the African Center for Systematic Reviews and Knowledge Translation, the African Institute for Development Policy, AFIDEP, and recently Stellenbosch University in South Africa. Now, who are the main players? I'm going to highlight the main players based on just what of my just general research. My apologies if your institute or department is not mentioned. With time, we will get to know about your activities. So now the main players with regard to research institutes, we have KEMRI, and I'll list or mention the main centers mostly involved in reviews based on publications and the database in the Cochrane database for systematic reviews. We have the Department of Knowledge Management, the coordinating body within KEMRI for these activities, the Center for Global Health Research, and KEMRI Wellcome Trust Program. Other research institutes are AFIDEP and the African Population and Health Research Center, APHRC, that are involved in systematic reviews and policy-making activities in one form or another. We now have academic institutions, University of Nairobi, offering trainings in systematic reviews, specifically institutes such as UNITAID, Department of Pharmacology, Department of Pediatrics, Department of Obstetrics and Gynecology. And with time, more departments will offer one module or the other. We have the Aga Khan University Nairobi also, that's also giving some training or some activities in systematic reviews. There are other institutions that I came across, and I couldn't list all of them on this list, but various universities all over offering modules in systematic reviews and meta-analysis, just short courses, not extensive. And from my investigation, it's just more of theory and not really actually conducting reviews, just a short module on the introduction to systematic reviews without the actual practice of conducting reviews. We have non-governmental organizations such as AFIA Research Africa. We now have the African Academy of Sciences, and just to highlight the recent initiative in conducting rapid reviews to inform policy making and decisions for COVID-19 in Africa. Other players are Ministry of Health. I'll just highlight some key programs that are actively involved in guideline development and evidence work, such as the National Tuberculosis, Leprosy, and Lung Disease Program. Other departments within the Ministry of Health are also involved in this, but at a small scale. And I think next time we'll be able to know who are the other players involved in this. The activities. I will mention Cochrane authors in Kenya, activities specifically within KEMRI, and activities by partner, giving an example of AFIDEP. Cochrane authors in Kenya. There are about 44 Cochrane authors whose country is listed as Kenya in Archie. Archie is the database that puts all Cochrane reviews together. However, just to note that country in this context means country of birth, not necessarily country of their host institution addresses. So some of these 44 authors are probably now affiliated with other institutions, but they're Kenyans. We have 2 academic editors within the Cochrane Library, and mostly the Cochrane Infectious Diseases Group, which is a really good thing, offering expertise and peer reviewing manuscripts submitted to Cochrane Library for publication. We have a total of 14 peer reviewers registered in Kenya who regularly review manuscripts submitted to the Cochrane Library for publication, so that's good. There are some Cambridge centers that are involved in authoring Cochrane reviews. So I went to the Cochrane database just to see the affiliations and associated centers. So I'll just mention the centers that are involved or rather have published Cochrane reviews. We have the Center for Global Health Research that actually has published most of the reviews in the Cochrane Library. We have the Center for Microbiology Research, the Cambridge Wellcome Trust Research Program, and the Center for Respiratory Diseases Research. Just to note that most of them are within the infectious diseases realm. So this just gives an idea that there's a gap with regard to non-communicable diseases. So it will be very nice if more authors in Kenya, within Cambridge for that matter, can start publishing reviews on non-communicable diseases as well. Activities within Cambridge. I will highlight activities within the Resource Development and Knowledge Management Department. That's the coordinating center for knowledge translation and evidence synthesis within Cambridge. And then just highlight activities within other Cambridge centers, focusing on the most active centers. Other centers most likely are doing a few activities, but at this particular point, we do not know. And I think this could be an opportunity or a gap for the knowledge management department just to collate all activities within Cambridge so that we can know which centers are actively involved in this and who will need methodological support. Now, the knowledge management department, as I mentioned before, it's a coordinating body within Cambridge. With the establishment of knowledge management in Cambridge, systematic reviews are to be an integral part of knowledge management activities. This department began training and mentorship activities in systematic reviews last year. Just to mention a virtual workshop that was presented in collaboration with AFIDEP. This was about introduction to systematic reviews and meta-analysis. And this was very timely, considering that last year there was a lot of hunger for reviews and meta-analysis to inform the COVID response. So this training occurred in August last year. Following from this workshop, there was a subsequent mentorship program that was started due to the high demand in just wanting to know more how to conduct systematic reviews. So I think about 18 Cambridge staff and students in total are being mentored as part of this program, all who are proposing different types of systematic reviews. So staff from other staff or associate staff or contributors are mentoring staff and students on just conducting reviews. And the knowledge management department gets a lot of support from AFIDEP with regard to its training activities. Cochrane Kenya is now nested within the Cambridge Knowledge Management Department since this year. The Center for Global Health Research. Now, this particular center has a research group known as the Evidence for Health Research Group that's funded by the UK MRC DFID research grant program and the UK NIHR. So this program is currently training PhD students, research scientists, and a total of interns, about 7, over a course of 4 years in research and also just training them on principles of evidence synthesis, meta-analysis, and research translation. So for individual products, there's a strong linkage with users of this evidence, such as Ministry of Health. As part of this research group, also we have supervision of MSc students who are conducting systematic reviews as part of their MSc theses. And then key collaborators for this group include Stellenbosch University in South Africa, Liverpool School of Tropical Medicine, as well as Imperial College London. Now, Cambridge staff and students, specifically within the malaria branch at this center, are currently conducting systematic reviews and meta-analysis as part of their international PhD programs or collaborating research consortium. And there's also a strong linkage with the National Malaria Control Program. Previously, it was evidence to policy focusing on evidence from primary studies, but right now there's a move towards also presenting systematic reviews and complex meta-analysis, such as individual participant data meta-analysis to the national malaria control programs during the meeting sessions. And then many Cochrane review authors are affiliated with CGHR, and hopefully we'll see that for other centers within KEMRI. We have the KEMRI Wellcome Trust Research Program in Nairobi and Kilifi. This program has an evidence and policy engagement platform with strong linkages with the Kenyan Ministry of Health, providing evidence and developing guidelines for Ministry of Health. And we saw that a lot during this COVID response when this program was actively providing evidence and summaries to guide the Ministry of Health in its COVID response in Kenya. This program also has a health technology assessment program, which is basically a systematic approach in introducing interventions. And it's a program that they're working with to institutionalize within the Ministry of Health. And evidence synthesis is a key component of this program. They've conducted training activities in evidence synthesis, health technology assessments, as well as policy engagement. Now, activities by partners. Before then, I mentioned activities by KEMRI centers, the main centers. Now I'm moving to partners, and I'm focusing on AFIDEP at this particular point due to time. Now, AFIDEP, Ministry of Health, and KEMRI and partners are currently implementing a collaborative program known as Heightening Institutional Capacity for Government Use of Health Research, in short, the HIRES program. The 3-year project aims to strengthen institutional capacity for the use of health research in policy and program decisions in Kenya, Malawi, and Uganda. The program brings together various partners under the HIRES East Africa Consortium with Ministry of Health of the 3 countries actively implementing partners. Now, what are the opportunities? I've presented the history, the players, the scope of activities. What are the opportunities going forward? I will highlight at least good news, what is happening and how that can inform the way forward. We have the KEMRI Knowledge Management Office that was established in the year 2016 with the purpose of developing structures for knowledge synthesis and translation aimed at improving the use of research evidence to inform health policy and practice. So that's something good, that at least there's a coordinating body, and this will bring together all the silo activities within KEMRI. As you have seen, there are activities in various centers. So just a collaborating body just to bring everyone together will be very useful. There's an increasing interest and conduct of systematic reviews and rapid reviews for that matter in Kenya. Rapid reviews, we saw the hunger for rapid evidence to inform the COVID response. And most likely in future, when we have other pandemics or other issues, there will be a hunger for rapid evidence to inform decision-making. We have now increasing grants for evidence-informed health activities, research and training awarded to Kenyan scientists, and these are competitive international grants. So that's a really good thing that there's funding to boost capacity in this area, and with time at least we'll have a critical mass of scientists who can provide methodological support within KEMRI and to partners in this particular field. We also now have PhDs focused on evidence-informed healthcare in Kenya. So most likely what you've been seeing is PhDs generally focusing on other aspects, so just a small component of evidence-informed healthcare. But now increasingly we're having PhDs who had trained in methodology, in evidence synthesis and knowledge translation in Kenya. So that's a positive outlook. We have increasing collaboration between research and academic institutes and NGOs for training and capacity building initiatives. For example, with AFIDEP, KEMRI, University of Nairobi, and with Ministry of Health to enable use of evidence. And of course, the main thing that has brought us together is the launch of Cochrane Kenya, the Cochrane affiliate within Kenya that will actively advocate for evidence-informed healthcare in Kenya and the greater East African region. Now, what are other opportunities for KEMRI? Now, we need better coordination of evidence synthesis and translation activities and outputs within KEMRI, such that when someone wants to know what's happening at KEMRI, there's a nice database or platform or a key person who can just give a broad overview of what's going on, and not just activities, output and impact on policy, impact on care, impact on research priorities. The next opportunity will be linkages with KEMRI's existing research platforms in field or laboratory research. KEMRI has a rich platform in field or laboratory research, good research activities. So how do you link this new area of secondary research with primary field or laboratory research? The idea is to avoid having everything as silo activities. You have a Center for Secondary Research and Synthesis and other activities for field and laboratory research. There has to be a way of linking everything such that people also conducting field and laboratory research can feel the need of having evidence synthesis and knowledge translation activities embedded within their field or laboratory activities. And this could be, for example, conducting scoping reviews to see what they're doing, rapid reviews to inform research priorities, publishing reviews on the work they're doing as part of the research consortia that they're involved in. And I'll just give an example, like at the CGHR, where currently we are conducting individual participant data meta-analysis. And this was about bringing together players in different parts of Africa who have been conducting research in malaria. So how do you pull together data from different data sets collected in all collaborating centers to just come up with a nice summary estimate to inform malaria policy? So this could be some of the examples that other centers could adopt going forward. Now, we need rapid review platforms to inform research policy care decisions, especially during emergency or pandemic times. Usually when it comes to pandemic, you don't have the luxury of 1 year to give evidence. People want evidence within 1 week or 2 weeks. Do we have capacity to give the Ministry of Health, for that matter? Should they require evidence within 1 or 2 weeks to inform the COVID response in Kenya or East Africa? So we need to develop a platform, and KEMRI could just develop this platform by improving capacity as well as resources, just to have a set of people who are available just to give rapid review evidence to inform decision making. Now we need resources to enable evidence synthesis activities. As we began the mentorship activities, one key need from staff and scientists and students was, how do we access electronic databases? Yes, now we have open access articles, but when you conduct your search in various databases, some important articles are not open access. So how do scientists, students, and other staff access electronic databases? Does KEMRI have access to all the necessary electronic databases so that scientists can be able to access literature to inform their research priorities, research and systematic review activities? We also need access to trained information specialists who can assist the scientists in developing such strategies. When you're looking for articles in these electronic databases, there's a scientific methodology for searching for literature. Do we have trained information specialists who can guide our staff and students, for that matter? We also need a provision of methodologies to guide various teams who are conducting reviews, and we've begun that with the mentorship program with the knowledge management department. And then also we have seen that in other centers, we are now training PhD students and other research scientists, and within time they'll be available. They'll give their expertise as methodologies in guiding other people on how to conduct evidence synthesis and knowledge translation activities. Then now capacity building in conducting systematic reviews, meta-analysis, and not just conducting, but in reading and using them. You'll be surprised that many people do not know how to read reviews or even use them to inform decisions. So we need training in conducting as well as in reading and using them to inform decision making. So the knowledge department unit, the knowledge management unit can spearhead this within KEMRI. Grant writing seminars, you always need money for anything, including evidence synthesis. So it's not always free. You need money for many aspects in conducting these activities, including knowledge translation, liaising with policymakers. So how do people write grants for this? Most people are trained in writing grants in the language of grants for primary field or laboratory research, but there's a different language required for research for systematic reviews, evidence synthesis, and knowledge translation. So if you do not know the language in grant writing, it's unlikely that you will attract grants to support activities. So I think Cambridge needs to come up with platforms in just training the scientists on how to write grants, incorporating even an evidence synthesis or knowledge translation objective in their larger grant proposals. And you need scientific methodology in doing that, because there's a specific language for grant writing for these activities, which many people do not know about. Now, we need more collaboration with other users of evidence, Ministry of Health, healthcare bodies or associations within Kenya and Greater Africa, other academic and research institutions, academies of science, and with other regional and international organizations, as Dr. Elia mentioned and Professor Weisonge. We also need linkages with funders, not only international funders, who are normally the main funders, and not only regional funders, but national funders as well. And then just starting small. It's always just nice to start small scale and then scale up activities. So that marks the end of my presentation. Thank you very much.
Thank you very much, Dr. Eleanor, for that very extensive overview of systematic review and evidence synthesis in Kenya. You have also given us a way forward, because going forward, we all need to inform decision making in Kenya. Now, if Professor Obonyo is not able to be online, I will continue with the session. But now, the next in this session is actually the celebrations, the unveiling of the Cochrane Kenya launch. So I will request the technical team to let us celebrate Cochrane Kenya. Thank you. Over to you.
Thank you very much. Allow me to start by greeting the participants of this KASH conference. We are today going to launch the Cochrane Kenya, and I thank all of you for being here with us today. We are very, very pleased, and indeed we have a lot to celebrate today. Why? Because today is the official launch of the establishment of Cochrane Kenya in the Kenya Medical Research Institute. The launch is coinciding with the KASH conference, the Cambridge Annual Scientific Conference, the 11th edition, being hosted virtually. And this is a very important yearly event in the Institute's calendar. Cochrane Kenya was officially registered in February this year. And this idea was pioneered by a few members of the scientific group who really had the mission to advocate for evidence-informed decision-making in healthcare in Kenya and in East Africa, and hopefully in the coming years in the whole of Africa. We are delighted as the Institute in that what Cochrane Kenya is going to achieve will also be a very big achievement and a big milestone in achieving our KEMRI strategies and by extension what we are mandated to do in the knowledge management department. So KEMRI, we all envision that as we host Cochrane Kenya is going to assist all the scientists in the institute, and we envision a better health in the whole of our nation through informed decision making in health with very high quality, relevant, accessible, and up-to-date synthesized research evidence. And with this, I wish to invite all the conference participants, all the scientists, and indeed all the scientists in Kenya to register as Cochrane members. And the registration, you can either register to be a reviewer, a contributor, or a publisher in the Cochrane Kenya. So with that, I would like now to invite the director of KEMRI, represented here by Professor Siongok, to kindly officially get us through this launching ceremony. Professor Siongok.
Yeah, thank you very much, Professor Arwa. On behalf of the Acting Director General of KEMRI, Professor Sam Kariuki, I want to state that KEMRI is delighted to host the Cochrane Kenya, as it will complement the efforts the Institute has been putting in promoting the use of research evidence in decision making among the various stakeholders in Kenya. This includes the MOH, the NGOs, and the county governments. Best scientific evidence is key in informing healthcare decision making. This will ensure that the success in health interventions and improving human health outcomes, which is in line with our KEMRI's motto, in search of better health. With these benefits, the institution is committed to support the smooth running of Cochrane Kenya in KEMRI by not limited to hosting Cochrane Kenya in KEMRI, providing the infrastructure, that is necessary infrastructure, including the offices and internet, doing the capacity building, or training in the areas of the Cochrane for Cochrane Kenya, providing dissemination channels for Cochrane Kenya, assisting in resource mobilization for Cochrane Kenya to get the necessary resources that could be able funds, personnel, etc. We are also committed to supporting linkages and collaborations with the universities and other research institutions, nationally, regionally, and internationally. Okay, with those few remarks, I now declare Cochrane Kenya officially open. Thank you very much.
Professor Mbogo, are you giving the last few, the closing remarks before I take over?
No, carry on, Dr.
And you can go on video kindly. Unmute Dr. Mkoe.
Sorry. Thank you so much, Vera and Damaris, and Professor Orwa for having hosted a very informative and very important center, the Cochrane, that will actually help Kenya, East Africa as a whole in terms of translation knowledge. At the moment now we want to close, but before we close, I've been told that all of you, could you please put on your camera so that we can take a photo of all the participants. Please put on your photos. Thank you. The chairman has not put his on. Yeah, I can see the chairman. So, Duke, tell me when you are ready and when you are through so that we can close. Are we through now? Duke, should we continue putting the photos on our cameras?
Wait 1 minute. Just continue being online.
Oh. Should we smile?
Yeah, you should smile. I think more and more people are joining, so. Okay, I think we should be done now.
Okay, thank you so much. I'd like to thank my co-conveners, Damaris Matoke, Veronica Manduku, and of course the guru of the meeting, Charles Mbogo, for this for inviting me to be the chair for this particular session. And I would also like to thank we already thanked the CAS who came here and all the other important visitors, including our CEO and our chair. So this session, opening session, is over. We will close it, take lunch, and then convene back at 2 sharp. We'll be having very nice, important presentation. So please don't fail to log in. Over to you, Manduko. Should we close completely?
Yeah, thank you, Dr. Mkoe. So when we come back at 2, of course, we are going into breakaway sessions, but you log in, we'll have the schedule uploaded, so you'll be able to know which session you're going to. You also reference the program that's on the website. We have the full view of the program so that you're able to select your rooms. The rooms will be labeled accordingly. You should be able to leave or join a room whenever you like, so that you're able to catch up with your interested topic. So let's come back here. It's good to come in before time so that we are able to start off on time. Thank you very much. Have a good lunch break, and we'll meet at 2 o'clock. Thank you.